Good morning, everyone, and welcome to Great Day Houston Medical Monday. We're starting with a health issue that directly impacts close to 1 million Americans, making everyday life more difficult as symptoms progress. At this point, there's no cure for Parkinson's disease, but critical research has yielded ways to mitigate various symptoms along the way. One extended release treatment can help patients enjoy more quality time. Neurologist and movement disorder specialist Dr. Michael Swallow shared how this treatment may be changing the landscape for Parkinson's care. Dr. Swallow, you've been treating Parkinson's patients over 12 years. You're also a clinical assistant professor and adjunct faculty at Dell Medical School. You love that part of medicine where you can help educate people and empower patients.
Yes, very much so. Been a movement disorder specialist, neurologist for 12 years, as you said. Love getting the opportunity to talk to patients about Parkinson's disease and giving them hope, hopefully by the end of the appointment, teaching residents and students as they come through our clinic, so someone will fill my shoes one day, hopefully. And then also doing clinical research and drug development and trying to get more options out to our patients to treat.
As they say, it takes a village, right?
Amen.
When a patient hears the words "you have," sometimes it's like, okay, relief, I know what it is now, let's get it over with. But sometimes it is something that doesn't get over with but requires management, and it's a process, and Parkinson's is like that.
Yes, very much so. So as you can imagine, if these are big appointments when they come to my clinic. Usually the whole family comes. They're waiting to hear if they have the dreaded P word, Parkinson's disease. And so we dive into that. We go through what to expect, most importantly, what we can do about it. And so what I find is it's all about the presentation. It's all about hope. So when they leave our clinic, they should leave feeling hopeful that we have a plan. They're confident in the diagnosis. They know exactly what they're going to get, what we're going to do about it. So those are all pretty important points that I like to make sure my patients know. And, you know, a lot of times we don't do the best job at kind of explaining things in a patient-friendly way. And so it's very important to me and my village, as you said, to make sure that they understand exactly what they have, what we're going to do about it, as I said, in a way that when their family asks them, hey, what'd that doctor say? They can repeat it back and they know exactly what was said.
What they're dealing with, what was said. All right, let me back up a minute and let's talk about what Parkinson's disease is. It is the fastest growing neurological disorder worldwide, which is concerning. Is it because we have a more aging population, we're living longer?
I think the aging population, certainly we're seeing it more and more, all kinds of theories and hypotheses, as we say, on what could cause it. But the reality is we still don't have a cause. We still don't have a cure. We still don't know exactly why it happens, but we're certainly seeing it more and more.
What's happening in the body, by the way? What's happening?
Yeah, so the brain cells called neurons produce a very important chemical called dopamine. Think of that like gas in your gas tank, so to speak. It helps us to move, and it helps us to do a lot more than just move. Think a number of different things dopamine plays a role in. And so with time, as Parkinson's progresses, the dopamine cells start to not be able to store dopamine, make dopamine, so we start losing those cells with time, and that's when the symptoms began more and more of.
And what are the early symptoms? Because often we're so good at dismissing things, and the problem too is that sometimes early symptoms mimic everything, and you can excuse it from I just didn't get enough sleep, or maybe it's this, or maybe it's that, right?
Absolutely, and aging, I think, is the first thing that patients often say is, well, I'm slowing down a little bit, I'm having a harder time walking, my endurance is not as good, oh, I must be just getting older, right? But aging can be more graceful than we give credit to a lot of the times, and so we always say one thing is stiffness and slowness, usually on one side of the body with Parkinson's. It could be on the right, it could be on the left, but once it starts on one side, it's usually always on that side as their worst side. And then slowing down as they're walking, patients will describe feeling like their legs are moving through molasses, they have weights tied to their legs, they're just having to really work harder, it's not as natural. And believe it or not all Parkinson's has a tremor. And so a lot of times we can see that fly under the radar, and patients will go undiagnosed with Parkinson's. They'll have surgery on their neck and their back because they have pain or stiffness, when in reality it's a low dopamine causing those symptoms. And then even before that, 10 years, 15 years before that, patients can have a loss of smell, and they can also have constipation, acting out dreams when they're asleep, so their spouses always are the ones who comment on that. And that can happen even before they start having the motor symptoms, we say the tremor, stiffness, slowness.
The things that really get our attention.
Yes, and that's when Parkinson's actually starts, is in the brain before we can even see it.
Okay. It's a complex progressive condition, which means it just keeps moving on, which is why, going back to what you said, managing it. There are some things that may work at sometimes, but as the body changes, you are ready there to respond to those changes. So, and as you also mentioned, no cure yet. There's two things kind of going on. One is the research part of it is how can we find a cure, right?
Yes.
But also how can we find better treatments? So take us through kind of the symptom management and treatment system, and it's not a one-size-fits-all.
Correct. There's a saying in our field, when you've seen one patient with Parkinson's, you've seen exactly one patient with Parkinson's. To your point, everyone's so different, and some have tremor, some don't. Some aren't bothered by their symptoms, some are, and some don't realize what's broken until it's fixed. And so we try to treat both motor and non-motor symptoms. That's what we say. Motor symptoms are the things that you would imagine: moving, walking, stiffness, slowness, tremor if they have it. The non-motor symptoms, though, those are the other things that go with Parkinson's. Mood issues, sleep issues, cognitive or memory issues can happen. GI issues like constipation, as I mentioned, all of these things are treatable. And so again, patients need to understand that, and so we go through that.
The goal is to get something called good on time. Explain what good on time means.
Absolutely. So going back to my gas tank analogy, if the gas tank is full, then patients can move appropriately, more naturally, if you will. But if the gas tank is overflowing, that can lead to something called dyskinesia. And that's what some patients with Parkinson's visually see. If they're moving and wiggling too much because they have too
involuntarily, much. Right?
That's right, that's right. So good on time means we have the medicine working well as it should without troublesome dyskinesia. So in other words, that dyskinesia that a patient could have is not troublesome. And our goal is never to have dyskinesia. Our goal is to have them moving without dyskinesia, especially non-troublesome.
All right, going into your research brain, we have seen some good and effective advances.
Absolutely. Very blessed with really good treatment options these days. One of the newer treatment options is a medicine called Crexont. It's a different version of levodopa. So in our pivotal trial that got Crexont FDA approved, it was compared against oral carbidopa-levodopa that's immediate release. And Crexont showed 1.6 hours of more additional on time without troublesome dyskinesia compared with immediate release carbidopa-levodopa.
And that's per dose, right?
Per dose, correct. And so that's what patients give us the feedback for, is that they want more consistency to their dosing, and they want that more on time without troublesome dyskinesia.
Are there any adverse effects?
There can be. So when patients are on medicine like levodopa or Crexont, the most common adverse events that are seen could be anxiety, nausea, sometimes falling asleep or excessive sleepiness. So even more the reason why it's important to talk to your provider team if you're having some of those symptoms, because after all, we can't fix what we don't know.
Can this work for patients who are in advanced stages of Parkinson's?
Yes, so we give levodopa to patients with early Parkinson's all the way throughout their life. And so the body needs to have the levodopa so it can get turned into dopamine and do what it's supposed to do. So I always tell patients that as your dopamine levels go down with time, we're never static. We're never still. We should be responding to whatever their demand is. We should be increasing their medicine and working with that recipe, adding things in, taking things away, just to make sure that we're keeping up with the demand. Because if we're doing what we are supposed to be doing, really they shouldn't have as many symptoms of Parkinson's, and that's our goal. That's what we're trying to do for these patients.
All right, Dr. Swallow, thank you so much.
Thank you for having me. I appreciate that.
And helping people with quality of life while dealing with a big challenge.
Yeah, thank you so much.
Visit Crexont.com for important safety information and more resources on Parkinson's disease. Talk to a doctor or healthcare professional about your treatment options and what might be best for you.